Well, hello. Looking out into the audience and seeing all the expertise that's housed here, I feel like we should do this Family Feud style, where we say, audience surveyed, top 5 answers on the board, here's the question. What are the 2 most available opportunities to achieve change and to achieve success in the time we have in front of us? But we're not going to. Instead, you're stuck with my thoughts. And as a means of doing that, because Christine covered so much, so wonderfully on the physical activity, physical education front, I'm going to cheat and focus on the nutrition side so that we can balance those 2 sides out. You know, when the Institute of Medicine published the Preventing Childhood Obesity Health in the Balance document in 2005, one of the core statements in that document was that we didn't have time to wait for the best possible evidence. We needed to move forward with the best available evidence. And the people working in the program and policy arena took that to heart when it came to schools, because logic told us, intuition told us, and the evidence we had at the time told us that we could make a difference if we improved the school health environment. We know it's a place where children spend more time than any other place outside of their home. When it comes to nutrition, most children consume as many as half of their calories in the school environment. And we knew there were policy pathways, things we could do to impact that environment. And so much has been done over the past 10 years. And in fact, the evidence has shown that those changes have been extraordinarily successful. We know that in schools where you actually implement healthy nutrition standards, we see an impact on child health, including BMI. And that was something that was merely a question 10 years ago. So what is the first thing that we can do that is an opportunity that lies before us? We can absolutely ensure that every food sold to a child in every school in America is a healthy food. The pathway to that is clear. States have passed policies, districts have passed policies, and that led the way for national policy change. In June, USDA issued their interim final standards for all food sold in schools outside of the school meal. The year prior to that, issued final standards around all food sold within school meals that will set the bar at a place that is technically higher than any state has set it to date, but that districts and schools have proven is absolutely implementable. And if we are to do this, we actually can reduce the intake of sugar-sweetened beverages and foods with high caloric density and low nutrient value to the extent that we will have the caloric impact that Dr. Dietz announced. So that's number 1. And number 2 is to implement the comprehensive strategies necessary to make sure that that impact is meaningful to the students who are receiving it. So from that perspective, it is, how do we maximize the quality of both the nutrition and the nutrition education that students are receiving in the context of their school day? So we're not just changing out what's in the vending machine, but rather educating students on the value of that difference, leveraging the community in ways that schools have actually demonstrated is possible via Let's Move salad bars, via farm-to-school initiatives, via other creative approaches that have gotten multiple community players working with the school in order to improve the quality of what's available in school meals and in the snack food and a la carte environment. So we're increasing students' access to fruits and vegetables, but also increasing it in a way that they learn to love and enjoy those things more because they're getting exposed to different things that are served in such a way that they can enjoy them. So that means making sure schools have the equipment they need in order to actually serve healthy meals, that they have the technical assistance and training that they need to then achieve those changes, and that we're thinking about, from a resource perspective, to Jim's question, how are we going to pay for that? There are great examples taking place in communities today of combining resources. So looking at a school may need updated facilities, but the community may also be looking to build a community kitchen or an opportunity to bring other people in. If we can work out a way, and schools have demonstrated it's possible, to actually leverage that school kitchen facility for other needs outside of the school day, we can make that win-win. So if we can implement the updated standards as are already out there to make sure that everything we're selling to kids is healthy, and then leverage the community, state, and federal resources as well as the ingenuity that's already played out in the field to maximize the quality and the educational experience the kids are getting, we can absolutely ensure that children are receiving both the nutrition and the nutrition education they need to have a healthy eating lifestyle, hopefully, for the rest of their life.